And then the final modality for today is the denture reference. This is something that is commonly used either in an immediate situation, right, immediate denture, or in an existing case, patient has a denture, go right into surgery and use this as the record for the bite, the teeth, the tooth position. Really, that's a nice way to set yourself up for success with these cases, especially restoratively. A patient can either have an existing denture or you make an immediate. We can design them, you can print them. We can design them and print them and ship them to you any way you like. No problem. We can also make you beautiful finished dentures that the patient can wear if you're not going to deliver that same day or maybe even the next day. So there's options there. Okay, patient comes in, you have a denture that you're going to use as the reference. That is your reference for the scan, the healing collars, the bite, the teeth, the tooth position, the vertical, everything. All right, let's go through a surgery. Go through the normal process. Whatever your process is, guided, unguided, freehand. Put the implants in, put the multi-unit abutments in. Then you will pick up the OptiSplint in the mouth. Pick it up. Do not scan this in the mouth. There's no need to. Take this out. You'll scan it on the bench. Okay. Then you put in your healing collars. You'll see these healing collars are some iCams. It's part of the library. It's fine. You can use them. You will scan. You'll scan these. You will not scan these in the mouth. You won't need to. That's a tough scan. Okay. It's optional. But really what we want is all-in-one scan. And in that situation, you will load both dentures with impression material, okay, and you will seat them, because this is really what we want. This gives us everything in one scan. So the upper is already in. Just simply load the denture with material, seat it, and close and hold in position. Now here's the trick. This is very important. You want to try that denture in, those dentures in, prior to loading them with impression material. These dentures cannot rest on top of those healing collars. Okay, these healing collars are kind of tall. They're very tall. So you probably want to use a lower profile healing collar for this process. Okay, but you do not want any burn through of the healing collars. These must be entirely in wash material. Otherwise the denture is tipping on one or more of the healing collars and you're not getting the proper bite. So do a wash impression. Right? Now you notice there's no screws or tads. We don't need them. This is going to be an iOS impression of the healing collars outside the mouth in the denture. All right, you've captured upper lower. Next step, scan the denture 360, scan both of them. Okay, what we end up with is this. Now you should also scan the denture outside the mouth. So you're going to scan the upper, lower. We don't need any intraoral scans of the denture. Take them out, scan one at a time, upper, lower, scan the intaglio, hold it in your hand, scan the bite. Yep, upload. Based on that, right, you're going to upload that along with the OptiSplint scans. You see these are intraoral scans. We don't want them intraoral, we want them extraoral for the accuracy. Okay, this is what you upload. 1, 2, 3, 4, basically three files, because these will all be in one event, and then the other event will be the OptiSplints. Upload that, we make you a prosthesis. All right, here are the records based on that, and those copings are just for visuals, just to show you how we have aligned the parts, and then we design your prosthesis, ship it to you to print. There are no copings, that's just a nice little pretty visual. Coping free. Or, as we mentioned before, make some models and make copings. No problem. Totally up to you. On our website, for all these different things we just talked about, you're going to upload it onto our portal. You'll log in. It's roedentalab.com. Up at the top of the screen, it says submit your case. And in here, you're going to pick Grammetry. See the product here? You'll have a drop down. This is how fast you want it. This is which arch or arches. What are we doing with, where are the photographs? Which screw are you going to use? Which healing collar? And then give us some instruction about the setup. You'll drag and drop your STL files into this folder here and upload them, and off we go. We have a bookings page, which I'll reference here in just a minute. And this will be a link so that you can pre-book your surgery. We don't want any surprises. We want to know when you're going to be in surgery, so you'll let us know. Okay, we'll get to that there at the very end. This is where you upload your files.